Hi, I'm Dr. Notisha Massaquoi. I'm an assistant professor with the Department of Health and Society at the University of Toronto Scarborough, as well as cross-appointed with the Factor Inwentash Faculty of Social Work. I think it's really crucial that social workers, particularly those who are working in primary health care, understand anti-Black racism in terms of how to address it, as well as to understand what the issues are that should be addressed by them as social workers working in the primary healthcare sector. One of the things that is important for us to understand is that Black people have the highest rates of stress-related illnesses in Canada, the highest rates of hypertension, heart disease, diabetes, chronic illnesses such as HIV, as well as depression. So the primary healthcare setting is a place where you are going to see quite a number of Black clients, Black patients in your practice. If you're not able to address the issues that they're bringing to you as members of Black communities, then you're actually doing them a disservice in your inability to provide care support that is required. The thing that you want to understand as well is that as social workers working in the primary healthcare field, you're going to be oftentimes the first point of contact in terms of seeing the impact of anti-Black racism on Black clients and Black communities. You're going to be seeing people coming to your office repeatedly with the same issues, the same patterns, the same concerns. And it's really part of our responsibility as social workers to not just treat each individual person as they show up, but understanding the patterns that a whole community might be experiencing. And therefore, it's our role to alert communities about their risk levels, their high rates of particular things. It's also your responsibility to deal with coming up with solutions, working collaboratively with communities so that you're not just treating each individual person, you're looking at how can I guarantee the survival and well-being of a whole community. I think those are some of the key things that are important for us to understand as social workers. You also want to think about, particularly in primary health care, that this should be a place of refuge for people when they're coming to see you to talk about issues of anti-Black racism that they may be experiencing. What are you doing in your practice to help people alleviate the stress, to alleviate any of the anxieties that can obviously be developed because of that experience? So we not only have to be able to understand the impact of anti-Black racism, we have to be able to understand how to address it and how to address it effectively as social workers. It's part of our obligation. Our obligation as social workers is to guarantee the survival and well-being of Black people, the survival and well-being of all of our clients, but particularly those who are experiencing marginalization.